If you've ever suffered from a headache with a feeling of tension around your temples, jaw or elsewhere around your face, chances are you've experienced a TMJ headache. This type of headache is related to temporomandibular joint disorder, also called TMJ disorder, which tends to affect women more than men. TMJ disorder refers to pain or other issues around the temporomandibular joints. You'll find these joints on either side of your jaw. Think of them as sliding hinges, connecting your jawbone to your skull, and enabling your jaw to move side to side and up and down. TMJ disorder can happen when these joints are affected by wear and tear or injury, but sometimes, we simply don't know the cause. TMJ headaches can occur as a result of TMJ disorder. So, when the muscles around your temporomandibular joints tense up, this can cause pain anywhere around your face, head, and neck areas. You might get other symptoms along with your TMJ disorder headache. These include difficulty and pain when chewing food, problems opening your mouth fully, clicking or popping when you open or move your jaw, ringing in the ears, also known as tinnitus, and changes in your bite or the way your teeth fit together. One thing's for sure, TMJ disorder headaches can be painful and debilitating for the sufferer. To know more about TMJ disorder headaches, check out our article or get in touch with our experts at OsteoHealth. To book an appointment, please visit our online booking site. Stay healthy with OsteoHealth.